All right, good afternoon, everybody. I'm going to call the Urban Experience Committee to order and hand it off to our chair, Councilmember Karen Stratton.
Good afternoon, everybody. It's good to see you all. Before we start in on the official agenda that you have, we're making just a couple changes that you might want to note. Under staff reports, we are adding, top of the list will be the discussion of the SHREC interlocal agreement and an update on the Safe Air Shelter that just opened this weekend, and that will be the mayor and her staff. You should have received the attachment on the next item, the 1590 discussion on housing. And then at the end, is Tim Donovan on the meeting? Okay, we'll wait to see what Tim does, but there was some discussion of a topic. Tim wanted to address the 2021 budget, so I'll leave that at the end for Tim if he chooses to make that presentation. So let's go ahead. Meeting's called to order. Can I get approval? I'm hoping everybody got to see the minutes. Do I have an approval of the minutes?
So moved.
Second? All those in favor?
Aye.
Aye.
Any opposed? Okay, the minutes carry. As we look at consent items, is there anything on the consent item list that anybody might want to pull off and ask questions or talk about? None? President?
I just wondered if City Attorney Ormsby could just speak briefly on the two special counsel contracts of what those cases are.
Sorry, it took me a while. The two contracts, the first one is the West Terrace water rates case. And so we have a trial date for next fall. And while we still have some room left in the current contract, we've got some pre-trial work that we need to do. And we just wanted to make sure that we had enough capacity within that contract to cover bills between now and probably the end of first quarter next year. The other contract is with the attorney representing us on a civil rights case that I sent the council all an email on, I believe, last week, but it could have been the end of the week before, where, in fact, we got dismissed from that case. The motion to dismiss was successful. We know we're going to get another bill, and it's not going to be sufficient. We don't have enough money on the current contract to pay that bill, and we also expect that the plaintiff in that case will be appealing. So we just want to have enough capacity available to pay bills as they come due.
Does anybody have questions for Mr. Ormsby? Okay, great. Thank you, Mike. Any other items on that list that anybody wants to pull off and talk about? Perfect. Okay, we're going to go right into staff reports. I'm going to turn it over to the mayor and her staff. Again, talking about the SHREC interlocal agreement, number one, and number two, the update on the Safe Air Shelter that opened this weekend. Mayor, take it away.
Thank you, Councilmember Stratton. Yes, before you is an amendment to the interlocal agreement between the City of Spokane and with SHREC. We found ourselves in a situation on Friday with our previous ILA expiring and needing to have mutual aid and emergency services continued. So after speaking with Council President Beggs and explaining the situation where we were in on Friday, talk with him about going ahead and under an emergency signing this amendment that's before you, and so that you could ratify this today. We are about to engage in new discussions with SHREC about a path forward with the agency. And so this amendment would come before you month by month We would extend whatever services we have with Shrek on a month-by-month basis as we continue to have these, I would say, renewed discussions with the agency we'll find out down the road if we end up joining or not, but we're going to get back to the table and start having some discussions with them. So as you'll see in this agreement, there is one, Section 2, it's the duration and the termination, month by month. So this latest agreement expires on October 12th, but Shrek is asking that we give them a 1-week notice before that expiration, whether or not we want to extend the agreement or whether or not they want to extend the agreement just to help with staffing purposes.
Does anybody have questions, concerns? Betsy.
Thank you, Councilmember Stratton. I am a little concerned about every 30 days renewal. About time the ink dries on 1 month, we're up for the next month. So it doesn't provide any certainty for like even a 60 days. 60 day wasn't even a discussion. 30 days just seems such a tight turnaround from month to month for this service that we provide to our citizens.
Well, we are in the process of looking at the possibility of beefing up our own staff for our own dispatch, fire dispatch. And so this is a service that we would need as we do that. We just don't have the staffing at our own fire dispatch level right now to provide that service for ourselves. And so this is a temporary situation unless we can, through new discussions, decide that we do want to join the agency.
And Council President here, I was just going to add that I totally agree with you, Councilmember Wilkerson. 30 days, month by month is not ideal. That's all they're willing to do at this point. And it is an improvement of their last, which was only 130 days, unless we agreed to join Shrek, which was untenable. While we're renewing these 30 days, it's going to be important that we hire the staff members we need to fully staff so that we're not vulnerable to really that sort of situation of either an ultimatum or an every 30 days of uncertainty. I talked to the fire chief today, and he said, it will take a few months to train the next cohort, but if council can give approval for the hiring of people, and I suggested even hiring ahead because I think we're going to probably get some retirements, so we train them all in one bunch. That's going to help us going forward because we'll have enough staffing and we'll be less reliant. So I'm probably going to be suggesting that we give budget authority to hire that next cohort. Right now we have, I think, 8 positions funded. We probably need 11, and we probably need another 3 hire ahead for future retirements or vacancies. So you make a great point. I think we're doing the best we can within the parameters that we have, but I really applaud the mayor for getting an agreement to actually sit down with a facilitator and work on our relationship and how our agencies can work together regardless of whether we use an interlocal agreement or some other method for coordinating emergency dispatch services.
Yeah, it really is a Band-Aid right now, and is a better agreement than we had in the former one. And so I agree with Council President Beggs that looking forward to getting back to the table to have discussions about a path forward with Shrek.
I do have just a quick comment question. I'm glad that thank you, Mayor, for getting everybody back at the table to talk about this because there's been such a disconnect for a long time. Mm-hmm. As I look at fees and invoices, the monthly fee then that the city will pay is the $57,600. As I go through the services, it looks to me like the vast part of that is going to be personnel. Is there a way when we continue these discussions that we start getting some breakdowns the funding, where the money's going, what we're being charged, so that we have just a line-by-line understanding of what we're paying for? I don't know if that's come up or if anybody else is concerned about it, but it's something that I can look at and say, well, $57,000, that's not much, it's a month. But I would be really, I think it's important that we know exactly a breakdown of what we're being charged.
Sure.
Who's doing what.
Yeah, we can definitely ask for that.
Perfect. Okay. Anybody else have comments or questions? Okay, we'll slide right into the Safe Air Shelter update.
Yes, that opened up this past weekend at the Convention Center, and just a huge shout out to Stephanie Curran at Public Facilities District, because she has come to our aid once again. You'll remember the arena is what we used for the 90-day shelter for our homeless when we were social distancing several months ago, and continue to do so today. But she came to our help at that time. So we're using the Convention Center. It's a 24-hour drop-in temporary facility for people who need to escape our hazardous air quality conditions right now. And this is for anybody, people who are unhoused or who may be at home and don't have proper filtration in their own residence. And we opened Saturday with about 5 people overnight. Last night we had about 36. We're providing 3 meals a day, thankfully, from the Women and Children's Free Restaurant, breakfast, lunch, and dinner. We are asking for public donations for water, liquid meal replacement drinks, and then also granola bars. There is a need for that, so we're asking for public donations, and people have been asking what they can do to help. We are anticipating that this Safer Air Center will be running through, likely through Friday, possibly through the weekend. We thought better weather coming in tonight and tomorrow would improve our conditions, but not enough to stand down the Safer Air Center. So we're staffing through Friday, and then with a contingency plan through the weekend as well if needed. We're expected to get rain this weekend, and that'll make a huge improvement on our air quality. So we're in the new convention center, if anybody wants to know, because I know there's always a confusion over the older or the new. We're in the new, and we're upstairs in Bay 1 right now. We have capacity for 200 people in Bay 1, but we can, there's flexibility. We can extend that and increase capacity for more if we need it.
Councilmember Wilkerson.
So, Mayor, what is the staffing level like down there? As I was watching the news, they were requesting volunteers. So what does that look like?
Yes. So we have city staff who are overseeing the center right now, including Sarah Nuss, our emergency operations director. She is coordinating the staffing levels. We do have volunteers. We've had volunteers step up from Civil Air Patrol, and some of them have been trained for situations like this. So right now we're looking at a staffing level of 1 to 40, but we actually have more than that right now. We had 36 people overnight, and we've had several people there staffing. So.
And who is providing? Sorry about that. And who is providing the food and the meals?
Yeah, Women and Children's Free Restaurant.
Okay.
They provided meals for us when we were at the arena, when we had our unhoused there, and they've been a great nonprofit community partner to work with.
Perfect, thank you.
And it gives them work as well, too. So.
Anybody else want to comment or ask a question? Mayor, thank you so much for making some time in your afternoon to spend with us. We appreciate the update.
You bet. Thank you so much.
And you can continue with your busy day.
Okay.
Okay. Okay, next up, we're going to talk to Melissa Morrison. We did send out the packet of information on her presentation on 1590, the discussion of sales and use tax towards affordable housing. Melissa, are you ready to take it away?
Yes, thank you. Let me get the slides up. So today I am here to talk about the Housing and Finance, what we've been referring to as 1590. Just a quick roadmap of where I'm going to be going is to give a brief background of what the sales and use tax is, how much it can raise, the targets of use for these funds, and then what we're looking at possibly using the money for. I'm just going to give a brief overview, and then we have two community stakeholders that will be giving a little bit deeper in-depth presentation. So this is just kind of the logic behind what the 1590 sales and use tax will do is that RCW 8214-530 provides the ability for the Spokane City Council to levy a sales and use tax for housing and related services. This was a change in the RCW that the City of Spokane City Council has been on the legislative agenda for the last number of years. These funds would, imposing the tax, 0.1% of 1%, would raise approximately $5.8 million a year that can go towards the construction of affordable housing and providing housing-related services. There is the ability to bond this revenue under the RCW. It is an option. It is not being said that that is the choice that would be made at this point, but just highlighting for council members that the $5.8 million is what we would anticipate receiving through the sales and use tax, but half of the money, these revenues could be bonded. And if it was bonded, the City of Spokane would still continue to receive $2.5 million yearly through the revenue. The affordable housing sales and use tax, the revenue raised can only be used for households at 60% or below the area median income, and then on the special populations outlined in the RCW. So persons with behavioral health disabilities, veterans, senior citizens, homeless or at-risk use of being homeless, unaccompanied homeless youth or young adults, persons with disabilities, and domestic violence survivors. So we're looking at or below 60% of AMI, which when we're looking at Spokane County, this chart shows what 60% of area median income is by household size, and then also some occupations that would fall into this range. So this is just to highlight that this program or these funds could be used to really target workforce housing and folks that are working, have full-time jobs, yet aren't able to afford housing at their current wages, just market rate, that they need some additional assistance. The 60% that is raised has to be used towards the construction of affordable housing. And so the goals would really be to increase the number of housing units in the City of Spokane, also encouraging shared equity and home ownership opportunities for households, and improving housing equity throughout the City of Spokane. I wanted to highlight that the money would also be used to help really encourage infill and missing middle housing development, and really following the comprehensive plan and trying to use infill as a way to increase the number of housing units in the city, throughout the city, and be looking at some new models that could really change the way that housing looks like now. The remainder of the money could be used to help with housing-related services, which really helps people maintain the housing that they're in, or to get into safe housing to help them in the long term. And so I want to turn it over to Edie Rice-Sowers. She's the Executive Director of Transitions in the Board of Spokane Low-Income Housing Consortium, to give some more information, and then Allison Polson, the Executive Director, put us all together.
Okay, thank you, Melissa. I appreciate the time. As Melissa mentioned, I am the chair of the board of Spokane Low Income Housing Consortium, as well as the executive director of Transition. So I'm coming to you representing SLIC and some of the work that we've been doing recently, and actually the last few years. So we've been talking about the need for local sources for low income housing since the 1990s. There's been considerable work on it. Some of you were on the mayor's task force with Mayor Condon. So we've been working on it a long time, but this is kind of the first time it looks like it might really be able to come to fruition. We've seen an increasing decrease in the federal and state dollars that are available for either home development or affordable housing development. For example, home money that's run through the city and also the county. In 1992, the city distributed $1.2 million to build more housing. In 2018, 26 years later, it was only at $1.3 million. With inflation, we really should have been at closer to $5 million. So those dollars have just over time continued to decrease. Really, the city's been working really hard to find local dollars for affordable housing, really in the past 3 years, really significantly. A lot of us began working with Melissa Morrison and then council president and now head of SLIC, Ben Steckert, in 2018 to identify a mechanism to build affordable housing. And so what you're seeing with Melissa's presentation is an outcome of that work. You saw on the document you received just before this meeting that there are significant priorities that are identified by that work group. Things such as home ownership and also domestic violence are being prioritized. So we know that housing is a base need. You all know about Maslow's hierarchy. If we don't provide shelter to people, then many of their other needs, such as mental health, substance abuse, and unemployment issues, can't really be addressed. And you know that Transitions recently built cottages in Northwest Spokane. Actually, Councilwoman Stratton was significantly involved in that project. So we know how hard it is to cobble together multiple sources of dollars. And as we talk to other developers through SLIC, we know that per unit, we still need to raise about $55,000 to $60,000 a unit. That money is not available in the community, whether federally or statewide. And it's very difficult to find that gap funding that we all need to be able to develop housing. The city's done a great job looking at infill, ADUs, and density. We also recognize the need for rental protections, but we have to increase the subsidy involved in building more units and providing those units, or we're not going to see movement. So why do you think 1590 is a good option? Local dollars tend to be a lot more flexible than state and federal dollars, and by passing this measure, Spokane can invest in home ownership and other co-op and shared equity models that would increase wealth and actually lift people out of poverty. As many of us know from our own home ownership experiences, that's often how we've actually moved out of a lower income status. So local dollars would also address systemic racism in our housing in Spokane. Communities of color are overrepresented as renters in our community, and House Bill 1590 gives us an opportunity to address this in a systemic way by building wealth, especially in that category of home ownership. So it's an opportunity that we have before us. We have not been in this place before. We're excited about this legislation coming before us, and we're asking that you now pass the legislation and provide local dollars for more low-income housing. We have heard concerns about that we haven't done enough outreach on this issue. And actually, the city began outreaching on a local housing level levy in late 2017, and we've been holding meetings of stakeholders every 2 weeks since then. Since 2020 and the passage of 1590, significant work has begun. We've pulled together a number of coalitions. We have a 30-member organization of low-income housing consortium, 30-member organization of Spokane Alliance, a 30-member organization of Greater Spokane Progress, the Coalition of Color, Spokane Community Against Racism, NAACP, Better Health Together Collaborative, and made up of 60 organizations and other directors of local not-for-profits. Businesses like Greenstone, Avista, and GSI have been briefed about this 1590. So community outreach has led to a guest editorial that you were sent in the Spokesman Review 2 weeks ago by the CEO of STCU and the CEO of Habitat for Humanity, and many letters to the editor. And in fact, I should have a guest editorial coming out soon as well. We've been doing social media posts about the importance of more housing, and we think everyone agrees we need more housing and that this is a path to make that happen. When this meeting is done, SLIC will be sending you a letter calling on you to act, signed by over 40 organizations representing thousands of Spokane citizens, and that we ask you to pass this on October 5th. So thank you very much for your time.
Allison, did you want to chime in?
Thank you so much, Chair Stratton. My name is Allison Polson. I'm the Executive Director of Better Health Together, and I thought I would give you just a quick snapshot of what Better Health Together is. Our mission is to radically improve the health of the region, and we've got a couple lines of programming that we're working on. The first is our access to care work and ensuring people have quality health insurance. Over the last 6 years, we've helped almost 200,000 people enroll and retain their health insurance. Our second set of programs is around our accountable community of health. And Better Health Together manages the state's Medicaid transformation projects for our region. We have the opportunity as a region to earn upwards of $70 million to invest in ensuring that people are getting healthier and that we are bending the healthcare cost curve. As part of that work, you might be asking, why is the healthcare nonprofit here talking about housing? But as part of that work, we have really grounded ourselves in a couple of key facts. The first is that only 20% of your health is determined by the healthcare delivery system. 80% of your health is determined by your zip code, your access to transportation, your access to stable housing, your access to employment opportunities, to childcare, your genetics, and your own behaviors. That was an important part of how we started thinking about Medicaid health system transformation. The second fact, and I'm sure you're all familiar with this, but it continues to take our breath away at Better Health Together, is that if you live on the South Hill, you likely have an 18-year life expectancy longer than if you live downtown. So you can start to play out my 80-20 rule here, and there's plenty of healthcare in downtown Spokane, but it is not resulting in people having better health. So for decades, we have paid for sick care, not for health. And part of this Medicaid delivery system reform work is really trying to get to how do we actually make people healthier. So we've taken on that challenge because BHG is a crew of tenacious problem solvers and tried to link together the healthcare delivery system with the social determinants of health work. So we started by establishing county-based health collaboratives in each of our six counties. In Spokane County, we have over 50 organizations that run the range from our healthcare and our behavioral health providers to housing, food, education, government, coming together to try and figure out how do we actually make people healthier. So this past year, we've adopted 3 health equity goals that all 50 partners have committed to working together on. The first is reducing family violence. The second is increasing behavioral health access. And third, across all of these organizations, was increasing housing stability, because healthcare knows you aren't going to be able to manage your depression, your chronic disease, your high blood pressure if you don't have a safe place to live. We've also challenged our primary care and behavioral health providers to actually start screening for social determinants of health. I'm sure we've all seen the newspaper articles and quotes from pediatricians and primary care docs who are like, if only I could just write a prescription for housing or for healthy foods, that would fundamentally change the health of my patients. So we have taken that challenge on and encouraged our providers to actually start to screen for housing stability, access to healthy foods, family supports like, do you have childcare so you could actually get to your job, so that we can actually start to collect the data, because we think we are way undercounting how under-resourced a lot of our Medicaid population is. Additionally, we have been paying a lot of attention to what is big healthcare and big insurance payers doing right now. And just in the last year or so, United Healthcare, which is probably one of the primary Medicare insurance providers in our region, has committed $400 million nationally to building, like actually building affordable housing, because they know if they can stabilize somebody's housing, you can start to get control of our healthcare costs. Kaiser Permanente, used to be Group Health here, now is KP, has committed $200 million to this. Additionally, we even see the legislature sort of getting into this game. They offered a pilot project called Better Health Through Housing that's based on a model of EV diversion and getting folks into housing. BHT just happened to be the successful contract holder of this pilot project. And so we've been working with Providence, MultiCare, and SNAP to actually use this as a mechanism. But the number one challenge that we're having is we can start to get people connected through good care coordination. There's not enough housing inventory available. And we see that pushing on all the different sides, both on the shelter bed side and how people might move beyond their needs when they don't need quite as much support in permanent supportive housing. So Better Health Together really sees 1590 as a crucial public policy decision that you all have to make. And we really probably couldn't stand more firmly behind this as one of the most important things we could do to improve the health of our region. So we appreciate your courage in moving this forward. Thank you.
Councilmember Cathcart.
Yeah, Allison, I have a question for you. So you made kind of a very broad, generalized statement I just want to follow up on. You said that zip code is determinant of health outcomes and that somebody on the South Hill is going to live longer than somebody downtown. And we've got $1 million condos downtown and $500,000 homes on the South Hill. And I'm just wondering, is that universally true, or are we talking specifically about low-income individuals who live in these various zip codes having a different health outcome?
Correct. It's an income issue.
Okay. Yeah, thank you. And then also, I was wondering, can you talk a little about, are you guys doing anything at the state level on some of these issues, particularly around nutritional food education and just education opportunities in general? Because I feel like if you're trying to get down to the basics of improving health outcomes, a better education system is certainly first and foremost, and then also ensuring that families, especially those that are using assistance, are in fact buying and making meals that are nutritionally good for their children.
Absolutely. In fact, we are super proud of Empire Health Foundation's investment over the last probably 8 or 10 years in scratch cooking. And so a majority of the kids in the greater Eastern Washington area have really benefited from a transition to scratch cooking that really tries to encourage both actual healthy foods that kids will eat. We've been really gratified to see OSPI take that on and start to disseminate that across the full state. So I think there's some really good work happening in that way. I think one of the things that we have seen really, really clearly in our Medicaid transformation work is you kind of have to get at some of the foundational elements before we can start to address some of the behavior related issues. And certainly changing somebody's dietary habits is an incredibly difficult challenge. And as we've been thinking about this is we've got to get more and more people stable. And whether that stable is housing or their behavioral health before you can actually start to address what are long-term chronic issues and long-term costs, which is where, you look at how much the U.S. spends on healthcare and how we are not getting our money's worth. But part of that is because our foundations are so limited and squishy in that way. You're spending money up here, but it's just we're not getting a full value. So there's a number of really cool sort of pilot projects, especially around diabetes management. That's one of the areas that in our region we've worked really hard on. But we are struggling with the sort of poverty impacts of people not being stably housed and being able to move into a more stable lifestyle.
Okay. No, I appreciate that. Thank you very much.
You bet.
So, Councilmember Stratton,
Go for it.
just like to comment to Councilmember Cathcart, it really is complex because it's just not the whole dietary. Look at some of our neighborhoods. It is a total food desert. That's one challenge, along with the financial resources to actually buy healthy food. If you look at what's compensated on what we call food stamps, a government assistance, that nowhere covers what we would like, in my opinion, to have a healthy, stable income. My experience lately, I had a gentleman who could see a dietitian because of his health issues, and that's an exception to the policy of the state. So not only that, if you do get there, there are so many hoops to go through to actually have access to that type of assistance in their overall health. So I agree. If they don't have a place to live, you can't get to the next level. Thanks.
Anybody else? Oh, Councilmember Kinnear and then Councilmember Mumm.
Councilmember Mumm, do you want to go first? Go ahead.
Oh, okay. Thank you. Sorry, I had a previous Zoom meeting that went long. Hello, everybody. Thank you for all the fabulous work that has been done so far on this very, very important issue. We all know affordable housing is key to really securing long-term housing for folks, and the way we've been approaching homelessness is not working with Band-Aids. I met with Melissa and Eric Polson for probably, I don't know, guys, half hour, 45 minutes. I had some pretty big questions that are still unanswered on this, and I won't take up the majority of our time here. I have read the ordinance. My questions are still hanging out there. And I do appreciate all the public outreach that's been happening over the last several years. I will say, when we're talking about raising sales tax, that's what I mean when I say we need more public outreach. When we did it for STA, it was almost a 2-year process. We're talking about taking our sales tax in our community to potentially 9%. And in the middle of COVID and an economic upheaval, I think we will be hearing a lot from our citizens about their capacity, especially lower income people. It seems like a small amount, but we need to take the time to really do the proper outreach with our neighborhoods and with our folks to hear what the citizens' feedback is. I know this is a priority for many, many, many people. So many resources have been tapped to again, put the Band-Aid on homeless. This is a smarter way to spend money. But that was one of my big questions. The other thing is, this looks like this is to be fired up February 1st. I can't even imagine that if the council acted within a matter of weeks, we would actually receive any funds that soon. I'm looking for criteria. Who gets selected for this grant process? What does the administration have to say about it? Are we funding a new position for that? Would that sit in the city side? Would that sit on the administration side, council, or is there a third partner that maybe could be used to do this? And so I really would like to see a business pro forma for this, how we're going to be able to fold this into our budget if we are going to pass the tax, how much of the tax would go toward administrating this or getting it set up, because we just don't have it in our budget or even our plans for a budget for 2021 at this point. So those were some of my big takeaways. I don't want to, again, monopolize all this time, but I feel like we just need to drill down on a lot more specifics before at least I'm comfortable to really heavily discuss it and take a vote.
So I have 3 questions, and probably 4, Melissa. I'm wondering why the tight deadline, why is it October 5th? I'm wondering if you did any outreach or study to determine what would be the average cost to a family of 4, for example, for a year. And also wondering if there is a sunset. So how long would this go on? How long would this last? Would it be a 20-year, a 10-year? So those are my 3 big questions, in addition to some of the ones that Councilmember Mumm voiced as well.
I am seeing a 20-year sunset that was put in there. That's a long sunset. I don't know that we can, when we get to that point, we can discuss the length. I was actually thinking one a little bit shorter.
Thank you for those. So Councilmember Kinnear, the cost, the estimated cost to the average household for Spokane is about $16 a year. So that's what the analysis from both Tim Donovan and then the budget office was, that this impact would be about $16 a year to a household. And then what was your first question? I'm sorry, I missed it.
The tight deadline of October 5th.
So October 5th is the soonest that council could take a vote on this. The way that 1590 was passed is the county has kind of the first bite at the apple. And so they have till September 30th to vote on whether or not they would impose the sales and use tax. And so October 5th would be the first date that council would be able to take action.
But again, why are we taking action on the 5th when there are these unanswered questions hanging out there? It seems to me we could have a longer time to really explore some of the questions that Councilmember Mumm was asking. Why does it need to be the 5th? If that is the soonest, what's the latest that we could take action?
There's not a deadline for the latest. The thought behind doing this as soon as possible would be just to be able to start collecting the revenues in order to start using as soon as possible towards the affordable housing. But there's not a deadline that we have to impose it by.
Has there been any conversation around partnering with the county so that the city is not responsible for all of the housing in the city, or for the citizens of Spokane to bear all of the cost of a sales tax when it could be spread countywide?
I have not had those conversations, but I could follow up with the county on that.
My understanding is that the way this was passed in the legislature, I thought, and maybe I'm incorrect, but I thought it had to be adopted by October. But essentially, the county has until October to make a decision if they want to adopt it countywide. And I think it appears they're not going to do so. And I know I've spoken to at least one commissioner who said that didn't think that they were going to adopt it. And then it falls upon the city to make that choice. And I thought we had till the end of October to make the decision. But again, I could be wrong on that.
Anybody else want to comment? So what I'm hearing is, Council President, go ahead.
Yeah, I just wanted to say that the reason we're having this conversation is to gather all the exact feedback that we're getting from everyone. So I really appreciate that. So that's what we're doing. We're trying to get answers. We've created a lot of answers as best we can. We'll get back to you with a little more on that, particularly how narrow the window is between October 5th and October 31st. But again, this is exactly what we want. So if you have other thoughts, questions, data, information, please let us know. My own thought is that we should talk in smaller groups and figure out what the best timing is for this council, for this consideration. The sooner we do it, of course, that creates revenues for housing. This in and of itself will not solve the affordable housing, even narrowed to workforce housing. But we're doing so much at the city right now and planning from the mayor's side and the council side that there really is an opportunity to try to leverage all the different sources, including we have 1406 money that's coming in, much smaller amount. We have the ability to use up to 50% of the TIF money that's coming in. And then again, we're talking about changing development and land use rules that will support things. So it's all part of it. And I think what's a little different than the rest of my time on the council is we're trying to put all of this together in collaboration right now so that we can really leverage, because it is only a bigger and bigger crisis, and the longer we wait, the harder and more expensive it will be to solve.
Councilmember Mumm.
Hi, thanks. Something else that came up, and I can't remember who was taking notes on all my questions. And Melissa, do you need me to restate those, or do you have everything from our last meeting?
I have the notes from the last meeting.
Okay. So you don't need all that. But one of the things that came out of that discussion is really talking also about geographically where these would be. They really need to be near services. They need to be near transit. They need to be near grocery stores, like you were talking about, Councilmember Wilkerson. They can't just be anywhere. And I think that's in my mind, from a planning perspective, for them to be successful and for the people who will be using them to be successful. So that's one of the things that's not defined that I think is important. Now, if we want to work on language that, narrows it to centers and corridors, that might make sense to me. But if we just throw this out, this could be anywhere, I don't think we're actually going to get at some of the heart of the issues and really leverage the possibilities here. And conversely, I don't think these should all be in one neighborhood. I don't think one certain part of the city should end up getting a whole cluster of these necessarily. We have to have it, equally spread out around the city in order to help several neighborhoods.
I have a question.
Councilmember Burke, and then Betsy.
Thank you. I just wondered if you guys had done any research or studies or, had any questions around co-ops and cooperatives, and I'm wondering if that's something that maybe could be put into the conversation. I'd love to see some sort of grant program where folks could purchase an apartment complex that's being sold if the tenants wanted to. And so that's just something that I'm really passionate about, and I'd love to hear if you guys have had those discussions or not.
I'd love
Go ahead, Bryn.
Yeah, I just wanted to second that, Councilmember Burke. I'm really excited about apartment cooperatives and actually increasing the amount of occupant-owned housing. And I think in the draft, I don't remember if in the draft ordinance, at least the first one, it didn't have that language, but I've requested that we do exactly that. And just for your knowledge and the rest of council, we have some money set aside from our strategic investments of 3 or 4 years ago to try to get those kinds of projects off the ground. It's not enough money to do lots of units, but to get the templates and the financial partnerships together to start doing that. So in my mind, this 1590 money is really going to be about occupant ownership, and apartment cooperatives are simply one vehicle that would be new to Spokane, but I think would be very powerful. So totally with you on that.
Councilmember Wilkerson.
I just want to make a comment to Councilmember Munn's statement about this denser housing being in specific neighborhoods. I know we're doing a dual track with zoning. Whatever we do in some neighborhoods has to be citywide. I don't want some neighborhoods to be able to control access to their neighborhood, and then all the development for workforce are kind of clustered in these other areas. So that is very important to me around that whole equity piece. It really has to go hand in hand, and zoning along with the money. It's critical that we do both at the same time.
Yeah, anyone that has questions or concerns about locations and neighborhoods, Edie has a bunch of experience with that. When we talked about the transition cottages, that was a definite eye-opener. And they, with their patience and their professionalism, they got through it, but it really was a challenge. And so, Councilmember Wilkerson, I agree with you on that. That would be something that I'm very interested in too, because I think it's important. Nobody else has any comments. Allison, thank you. Edie, thank you. Melissa, thank you. Good job. It seems that we need to have a few more discussions, get some questions answered, and maybe that will lead to a study session. But let us know, or let Council President know. They're tracking the questions, and we'll take it from there. But definitely a good conversation to have, and I appreciate all the work that's gone into this. Oh, Candace.
Well, I just think this is a great opportunity to use Lisa Gardner for a community outreach plan on sales tax. We very rarely vote on sales tax, and I think it's something everybody has an opinion on. And especially when it's being used for a great concept like this and important work, I just think this is something that we'd probably want to have as well.
A good idea. Anybody else before we close this discussion? Okay. Thank you for participating. Those of you outside of City Council, we appreciate it. And now we are going to head to Councilmember Kinnear, who is Queen of Park Rules and Regulations today.
Thank you. Just a little background. I have Mary Miramatsu that's going to be able to answer questions for you all. And I think Garrett Jones, Justin's on our team here as well. So a lot of folks from Parks. This has been, I would say, brewing for a while and came to a head when I got emails from Brown's Edition and what was happening in Coeur d'Alene Park. I was hearing concerns also from Councilmember Stratton's district in Corbin Park as well, Liberty Park, Underhill, and Riverfront Park. And those concerns all centered around needles, drug paraphernalia, trash, and large groups with either sound systems, bullhorns. So a lot of folks that were congregating in parks, but not following park rules as they were set out. So I contacted Mary Miramatsu. I said, how can we clarify some of the rules around parks so that people understand what they are and are held accountable for the mess that they may create? So when we opened this up, we changed some things. And what this does, three things basically. It clarifies the rules so everyone is operating on the same page with the same guidelines for what's allowed, what's not, and what requires a permit. It provides tools for enforcement. And specifically, these changes would allow us to reclaim costs for the staff time that it takes to keep our parks clean when large groups leave behind a mess. It also prohibits drug paraphernalia and drugs from being in and adjacent to our parks. And oddly, that wasn't in our code before. Marijuana and alcohol were listed, but not illegal drugs. So now that would be. And Mary's going to be answering questions. What I would like to say is this update was a collaborative effort with the administration, with Parks, SPD, and legal. It has gone before the Park Board. They're supportive. And after I get everybody's feedback on council, I'll send them a final version. And what I would ask is today, let's ask questions. And then if you have any changes you wish to make, send them to Jacoby so that he can collect them all and send them to Mary Miramatsu for consideration. So with that, I'm going to open it up to questions. And Karen, do you want to adjudicate the questions so that everybody's not talking at once?
I've got a question.
Okay, Kate, go for it.
Thank you. Mainly, this is actually maybe more for Garrett, but I know that you guys started a pilot program to collect needles in the bathrooms at some of the parks, and I just wondered if you had an update on that. Has that helped at all? What does that look like? Yeah.
Sure. Thanks, Kate. We have started a pilot program, and a lot of that stemmed from a lot of issues that we're having at Coeur d'Alene Park. We've found any type of needle distribution or dispensary unit that we had to make them custom made because any of the usual ones that you would see in our parks were getting broken into and being reused. We haven't seen a decrease in that activity. We still see periodically our plumbing. So our restrooms weren't open this year, but last year we saw a lot of issues where the needles were getting flushed down in our toilets, getting backed up. And so our staff would have to go in there, actually remove the toilet and take the needles out of the toilet and then reinstall it. I think our issue is using park facilities as a distribution center where there isn't the coordination or accountability with the health district or other organizations that are certified in this type of activity in the places that it's happening in. So as you can imagine, we still find used needles in our playground equipment or in the engineered wood fiber. And that increasing when we see this type of activity or distribution happen in our parks. And so that's why you see under that drug paraphernalia section of eliminating any of that type of activity on parks property.
Okay, thank you. I guess just my follow-up is probably more just a comment, not really a question. I feel like we keep going backwards on the way that we're trying to prevent this type of stuff from happening. We should be putting in preventative measures like folks being able to access clean needles, folks being able to go to a place to get services and get on medical services they need and things like this. And I feel like this is just a way to harm them more than they are already hurt. And so I'm not supportive of something that criminalizes more of what we're seeing. We already know it's going to continue to happen. So I'd like us to try to work to take a different approach as we move forward with evidence-based programs that actually help these situations. There's a lot of evidence out there. I'm happy to send you all sorts of things. So I've been working on this issue for many years now, and this is a step backwards because it makes the folks who are hurting hurt more.
I would just comment on that, that might be a wonderful opportunity as we move through this to create a partnership with an agency that might be able to help us provide that information or those resources. I'm not sure how that would look, but I think there's a pretty good partnership between the city parks and an outside organization that could work on that. So that would be...
Yeah, absolutely. And the health district does distribute needles, and I've visited that area, and they've helped a lot of folks get rehabilitated onto methadone and then off of methadone, and they are contributing people to our society. So I'd like to see us move in that direction rather than harming an already existing person who's in harm.
Thanks, Kate. Betsy, and then Michael Cathcart.
Well, I was just going to follow up on Kate. I thought the health district had a mobile needle exchange program. I know that they had one in the past. I do not know if that is still in current use. So that'd be something, looking at partnerships, what would that look like?
Michael?
Yeah, I just was going to add, I'm very supportive. I appreciate Councilman Kinnear bringing this forward. I think one of the big complaints, concerns I heard over and over again last year, and I continue to hear it today, are just the concerns over finding needles in our parks and the how unsafe, unsanitary, and quite frankly dangerous it is for families who want to utilize our parks and just feel like they can't because they just don't know if there's a needle lying under that grass that they might step on and potentially infect them or just harm them in some way. So I'm very appreciative of having these restrictions in place. I don't think the parks are the places where needle exchanges and things like that should be occurring, nor are they the place for drug use and paraphernalia to be left. So I certainly appreciate this coming forward, definitely support it, and look forward to passing these amendments.
Does anybody have any questions for Marimiru Matsu in terms of how this was crafted? The needle piece is just a small piece of what we're working towards here. The biggest concern for some of the folks was noise, also trash, especially food waste. So the other piece, well, I'll leave it at that. If you have any questions of Mary, it would be a great time to ask.
So I would just, because I'm the, we got and Garrett can back me up a little bit on this. We get complaints a lot from individuals living around Corbin Park, and it's everything from noise to, you know, groups in the park, didn't have a permit. So I guess the only thing that concerns me about this is working on how we communicate to the neighborhoods to make sure that neighborhoods understand what the rules are. I know during this last complaint, I didn't know, nor did the folks that are involved in that neighborhood, but they had put a, what do you call it, Garrett? They weren't enforcing any rules in parks as far as getting a permit and that kind of thing. So the neighbors are going out yelling at the people in the park who are on microphones and having a church service, thinking that they need a permit. So they call me and I don't know. And it turns out that those, sorry about that, those permits were just, everything was stopped during COVID, which I totally understand. But I think that my concern with this would be how we communicate it and the enforcement. And can we really go out and say, if you call and you have needles or noise or whatever in your park, that we can likely go in and enforce it, and how that happens, if that makes sense.
And if I could, Karen, I think that's a great suggestion. I think a lot of what the revisions you see today is because of communication and coordination. And I think this gives us the tools to be able to enhance that communication and coordination and the follow through through these type of events, and also gives SPD and our park rangers more tools to be able to work with. And I think that's important as well, as we know our resources are very thin. But also, too, it gives the actual event organizers an opportunity as well. You can see in the revisions, there's a warning at first. There's no exclusion of parks. It's a warning to work together, to saying, hey, if you're going to do this type of event, that's great, but let's make sure it goes through the proper channels. There's the coordination, there's the follow through, and make sure that it checks all those boxes so that we know that the parks are still safe and healthy for all, and that we are not left with a large mess and to where we don't have the resources to be able to maintain that. And so through that, though, too, I think that's really going to help with the communication that we haven't had, because, and again, our communication teams is phenomenal. So once, you know, what direction the council may take this, we'll go back with our communications team and make sure, so I think that's a great point, Karen, that the neighborhoods and all our partners that we have that utilize our parks know the updated information of what needs to take place.
Thank you. Any other comments?
Sherry, do you want to add anything?
If I could just add to Garrett's comments, I think the real strength of this revision is that it formalizes the special event permitting process in the park code. Right now, if you read Chapter 1206 of the Spokane Municipal Code, there is nothing in there regarding special event permitting. And so this sets out a process, requirements, and it references, and I'm not sure if you have the most recent draft, but it references that special event permits are subject to Chapter 1039 SMC, which is the special event permitting chapter, and also abiding by park procedures for scheduling events. So recognizing there's already a website, there's already a set of rules, now we're putting it into the park code where it's plainly visible to everyone. And as Garrett mentioned, you know, before anybody actually is subject to recovery costs or subject to any sort of restrictions surrounding not having gotten a special event permit, they're given a written notice, a notice that they're subject to a permitting requirement, a notice that they're subject to cleaning up their event, and letting them know that costs of recovery will be pursued if they don't. And that really equalizes things for everyone. What we're hearing in Brown's edition and other places is that the goodwill of the neighborhood has run short. People are having to go out from their homes and clean up these large events they've had no part in. And that's just not fair. It's not right. So this sets out, I think, a more robust, more plain process for the public to see that they are subject to a special event permit if it's the type of event that tends to draw a large number of people and it has some sort of an impact, either the use of city services or it has an adverse impact on the neighborhood. And so this also requires, right now, there's nothing in the park code about it, but that the individual seeking that permit would have to present an operational plan, something that would indicate how they intend to clean up after their event. And so this really does outline rules, sets out recovery costs, and makes all of that very clear. There would be obviously penalties for those that are distributing needles in the park, because right now that's not allowed under state law. That is prohibited. If you're not working with a health district and it's not part of the mobile needle distribution program and it's not authorized by the health district, you're not allowed to do it. It's called distribution of drug paraphernalia, and it's illegal. And so the nice thing about this, I just kind of want to add as a comment to Councilmember Burke's comments, this doesn't actually create any new penalties. The penalty for distributing drug paraphernalia already exists under state law. The penalty for selling or giving drug paraphernalia in the parks, it's exactly what it is under state law, and it's also what it is under the Spokane Municipal Code. We've already got that codified. What this does is it puts it in the park code because it's also public property. It's the same exact penalties, so we're not creating any crimes. We're not creating any penalties that haven't been around for decades. So this just makes it very clear to the public what those requirements are.
Anybody else? Garrett?
Going to talk.
If there's not any other comments, I just would like to thank, first off, the leadership from Councilwoman Kinnear, and then Mary, and then Justin Worthington that leads up our park ranger program, and Captain Tracy Meidel is a huge resource to all of this. Also, too, a huge thank you. A lot of this, we don't see the huge impact because our neighborhood associations have stepped up to the plate to volunteer their time to clean up the mess, and they're tired. I mean, and we're all kind of, as resources are getting, through the COVID pandemic and less staff that we have, boots on the ground. But if it wasn't for the neighborhood associations and our volunteers out there, the visual impact that you would see in our parks would be magnified to a large extent. So we can't thank them enough through this process and to find win-win solutions. And so, Browns Addition was a great example, but this is happening in the Northwest. This is happening up in 5 Mile. This is happening in the South Hills. So we can't thank those groups enough.
So, Councilmember Stratton.
Yes.
I'd like to reiterate, if you have changes you'd like to see, please send them to Jacoby, and we'll consolidate them and send them on to Mary. We're looking to drop this on Wednesday so that we can move it forward. But if you have changes, please send them on to Jacoby. And I thank you all for your time.
Thank you. That was great. Oh, Candace.
I was just going to ask, does the park board need to take any action on this, or are you getting enough feedback from them, or do they know about this?
And so they do know about this. I presented it to them at the last meeting. And once that council has given us their changes, then I will send them a final copy.
But they don't need to act. We can take care of this.
Good, Garrett, can you answer that?
I think for consistency, we would take it through the October park board meeting. So that second Thursday in October, we would take it through just to have the consistency that we've had in the past.
Thank you.
Well, thank you, everybody. That was a lot of work and very needed. I have a feeling if we weren't going to do anything, it was going to get worse. So this is good to do with it. Thank you, Mary, as always, for joining us. Appreciate your hard work. So, Garrett, I've got you. You've got it. Do you think you could get through the urban zip line timeline process quickly? And then I'll bring Kyle up to you since I've got you talking.
Well, my part will be very short. So I'm going to introduce John Moog, Director of Riverfront Park. He's going to be our staff lead on this. If you know a little while back when Rick Romero was still employed with the city and Gavin Cooley, we came to the committee and talked a little bit about the idea around an urban zip line. This was mentioned in our master plan for Riverfront Park as another kind of third-party potential outdoor activity. We took comments from the committee back then. We kind of reconvened the group most recently, and council members Kinnear and Wilkerson were part of that initial meeting. And so we wanted to come back with some timelines and initial next steps, get some additional feedback. So I will hand it over to John.
Great, thank you, Garrett, and good afternoon, Council President, Council members, and colleagues. Let me go ahead and share my screen really quick. I have a new setup today, so please forgive me if it's not completely clear. All right. All right. I need to swap the screens. All right. Are we good to go? I think everything's set up. Perfect. Thank you so much for your feedback. All right, so the purpose of this meeting is going to talk about and introduce the feasibility of an urban zip line in downtown Spokane. This discussion will outline the approach, process, and timeline to build a zip line through a possible public-private partnership. I'd also first like to acknowledge other members of the team, including Kyle Tuig, Barry Elliston, Mark Richard, and Meg Winchester, who are either watching or cannot be present today. So industry groups estimate that there are approximately 400 commercial zip lines in the United States and 70 million rides annually. Urban zip lines are unique. You might ask, well, what is an urban zip line? Why is it unique? Well, it's not only set in an urban destination, but they're usually a single ride attraction as compared with zip line tours, which have a course of multiple zip lines. Urban zip lines are sometimes paired with a much smaller orientation zip line to increase rider familiarity, confidence, and safety. So like Garrett just mentioned, we have backstory. Originally, the zip line was proposed through the RFP Master Plan Advisory Committee, but it was proposed in the context of a privately run destination ride, such as a giant Ferris wheel or a viewing tower. And this destination ride was viewed to be on the north bank of Riverfront Park. Well, today we are happy to be moving forward with the sports complex and a regional playground. Also, elements of the master plan leave no room for a destination ride. So where we are today, we're reintroducing this proposal back to the community. What we've been able to hear, in 2019, the construction of the CSO tank operated an opportunity. During this project, an engineering feasibility study was completed on the potential zip line, and it concluded that it was possible, but the cost would run about $900,000. Well, not within our budget. So, the zip line itself would be spectacular. It'd be a bold, adrenaline-filled adventure in the heart of our beautiful city. It connects people to the river and drawing those near and far to truly experience something unique and special. I'd like to talk about the concept and specifications of zip line right now. So the proposed site was proposed by Speed Fitzhugh, who was with Avista at the time but has now retired. And he suggested that we fly the zip line between CSO Tank 26 under the south arch of the Monroe Street Bridge, skirt the edge of the Spokane River, and land in Red Bend Park. The platforms are considered fairly constrained due to the CSO tank infrastructure and cultural sensitivity of Red Bend Park. Additionally, the placement of the zip line would be outside of the Federal Energy Regulatory Commission's boundaries, or what we can call as FERC. This license is managed by Avista, so we've been working closely with Avista to affirm that these will not be impacted by the FERC boundaries. We will work again with them as we go forward within this project. The zip line itself will be a commercial grade zip line. It will have 2 parallel lines that run approximately a quarter mile from the CSO tank to Red Band Park. And commercial zip lines like this require steel or wooden poles, concrete structures. They require engineering expertise on geology, foundation, structures, operations, and maintenance of systems. They consist of 2 platforms, an upper and lower platform, and the platforms have at least 6 foot footings and highly tensioned cables. Riders zip across with harnesses attached to trolleys, and the concept right now is to separate the upper platform at the CSO tank by the way of a drawbridge, so it can be secure but not in use. The overall zip lines are accessible pretty much all, from youth to seniors, and support most with disabilities. So I wanted to give you kind of a visualization of what this might look like. This is a 45-second animation of what a possible zip line would look like, courtesy of Bernardo Wills Architects. The views will simply be stunning here. So if you launch from CSO Tank 26, we're going to go underneath the first arch of the Monroe Street Bridge. We'll go across the river, and then we land in Red Band Park. The landing in Red Band Park allows us to connect the experience to our tribal heritage in this area, a key discussion point with the Spokane tribe in the future. I think the important thing here is, why do we want to do this? First, it aligns with and increases the advantage of the urban experience. First, it connects people and culture to our natural resources. It aligns with our priority of creating economic benefit and access to the river. And specifically, the project bolsters activities to encourage tourism, strengthening the hospitality industry, and encourages new residents to live in Spokane. Oopsies, I gotta go back. The urban zip line is considered a major attraction destination. Like most destinations, it will elevate Spokane's value proposition and desirability to tourists, conventionaires, and locals. Unique attractions like this help close deals. Perhaps Meg Winchester said it best when she said, as a destination does not have a real major attraction like a theme park, it would be so great to add something exciting and different to our inventory. It would be such a fun thing to add for us to market as well. Mark Richards, CEO of the Downtown Spokane Partnership, has said, this facility would put Spokane among a very small and elite group of cities that have a truly urban zipline experience, just steps away from hotels, retail, and dining. We feel confident an anchor attraction such as a zip line will give Spokane an economic boost, which we feel is badly needed to help the economy and hospitality industry recover post-pandemic. Also, it adds to our growing list of spectacular things to do in Spokane that attract new residents and retains our young adults. It also attracts older teens and young adults who are currently underserved in Riverfront Park. As a private-public partnership, the revenues would be used to offset the park and plaza maintenance and serve our disadvantaged communities, and I'll get more to that in a second. Some of you are aware that Riverfront Park is its own zone in the Business Improvement District. I'm currently the elected chairman of the BID, and I'd like to speak to you from that position for a moment if I could. The impact of such a destination attraction would serve as a catalyst for downtown, hotels, restaurants, and retail shopping, inviting both Spokanite and more tourism to come to downtown. Between major improvements at Riverfront Park and the Sportsplex, Zipline is another impactful attention grabber that activates and strengthens the Spokane's value proposition. There are no doubt a lot of reasons why we should do this, but it also causes us to be mindful of the risks, and the safety comes to mind. I know there's been concern on council before regarding safety, and I want to take some moments to address that. Similar to amusement rides and the ice skating ribbon, swimming pools, and skate parks, they all carry risks that can be managed through professional engineering, adherence to industry standards, and accreditation of operators. The zipline is no different. The industry authority for zip lines is the Association of Challenge Course Technology, or ACCT, which develops standards, policies, procedures, and certifications for zip lines. ACCT is also the American National Standards Institution accredited standards developer, so for ANSI, in other words, for zip lines. So they help create all the industry standards and practices for zip lines. When we move forward with the zip line, we will require zip line operators and engineers and contractors to be credible ACCT accredited operators. Additionally, ACCT also reviews and accredits policies and procedures related to the operation itself. Regulatory bodies. Regulation for zip lines in the state of Washington is done with the Labor and Industries Amusement Park Division, similar to Riverfront Park and our amusement rides. There is no federal regulatory agency related to zip lines. They conduct mandatory annual investigations, and their inspectors are required to be ACCT certified. Also, safety is very important in this industry. Each participant will wear a full body harness, as well as helmet and leather gloves. Each rider will have their own individual trolley system. This personal protective equipment is inspected daily. In addition, all the procedures and communications that the operator would use are reviewed by an accredited third party. They'll also undergo daily and monthly inspections and perform routine maintenance. Some of these inspections may include inspections for broken wires, displaced or loose wires, physical damage on impact areas, visual inspection of impact areas and cables, and diameter reduction of the cables. That's great, but perhaps the most important question is it safe? Is the question that I hear a lot. And the general answer is that commercially operated zip lines that are engineered in accordance with industry standards, or ACCT, are in fact safe. According to an expert in the field, Ian Adamson from Robson Forensic, he is also the president of FISA, World Governing Body for Obstacle Course Racing, and mechanical engineer, and a committee member for ASTM Standards, has said such a thing. There is no current database for injuries to access, but what we do lean on is a 2015 study by the American Journal of Emergency Medicine for zip lines. And in that study, it says zip lines account for 11.64 injuries per million of the population. This is higher than the amusement ride industry. And the one reason for that is because the industry statistics count everything from your do-it-yourself zip line in your backyard to highly engineered zip lines on a commercial application. And because of that, the statistics are a little bit skewed. In addition to those other injuries, about 12% of those are resulting in hospitalization. And in 10 years between 2006 and 2016, there are about 16 reported fatalities. Again, the statistics misrepresent the industry safety. It is widely believed that the majority of these injuries are associated with the do-it-yourself devices and are not operated by commercially accredited operators. The partner operator engineering of the zip line will comply with all ANSI, ASTM, and ACCT standards, just like most commercial operations adhere to in the United States. We are proposing a private-public partnership for this destination attraction because it yields the public and economic benefits previously mentioned while deferring financial and operational risks to an accredited professional operator. The outdoor adventure industry, and specifically zipline rides, are trending towards private-public partnerships. Public entities are looking for increased tax revenue, tourism, and activation of their urban advantage, while operation partners are looking for an ideal and unique location to place their popular attractions. The city, under this concept, the city would provide the location, and a minimum 10-year contract to allow the partner to recover their investment. In this model, we would like to see a seamless integration with riverfront operations to improve service to our public. We also see an advantage of integrating our briefing rooms and points of sale locations. The city would receive a gross revenue share, which we want to use to offset the cost of CSO plaza maintenance and riverfront park maintenance. On the other side, the private partner would provide the capital, construction, expertise, operations, insurance, and indemnification of liability for the attraction. They will receive increased visibility from the location of their attraction and increased revenue. There are a couple requirements we'd like to see as part of this partnership. One, community-based initiatives will be required. We want, just like Riverfront Park seeks to find free and low-cost programming to our community, the selected partner will be expected to provide free rides to charitable organizations, those with low income, and underserved youth. This is usually a negotiable item within the contract that results in a lower percentage of sales at the contract. Second, we would like to see connect the attraction to culture. We see opportunities to tell the Spokane and tribal stories through narrative tours and interpretive signage that meaningfully connect the experience to Spokane's urban experience, therefore connecting people to the river. And this will be something that we add in the request for proposals process.
Jonathan, do you think you can get it done in about 2 minutes?
I sure can. This is the last slide.
Perfect, thanks.
Excellent, thank you. We estimate the project will take about 23 months to fully realize. This is a conservative timeline, and we hope to move faster than this. The process will follow a similar path to most capital projects. Starting essentially today, in the next 4 months, we will be meeting with other authorities having jurisdiction to discuss feasibility and conditions. Within that process, we'll meet with the Spokane Tribe, Avista, Department of Ecology, Army Corps of Engineers, Department of Fish and Wildlife, Streets Department, City Planning, and Historic Preservation Department. We'll also conduct a public outreach process with the Riverside Neighborhood Council and the Peaceful Valley residents to get their input as well. I'm also providing this committee and the Park Board periodic updates throughout the process to make sure that you are aware and can provide your input along the way. For the RFP process, we'll be seeking a partner to invest the capital, design, engineer, construct, and operate a potential zip line. We'll include all the conditions from our earlier outreach, and we'll create a diverse selection committee of all stakeholders. So we'll be reaching out to our council liaison to get her input on that selection committee stakeholder. And again, that's pretty much it for the process. It's fairly straightforward. And like I said, I know this is the end of the line. The presentation was intended to introduce and explore the feasibility of this concept and through a possible private-public partnership. I invite you to ask any questions, comments, or discussion. Thank you.
Candace, did you have a question?
Yeah, I actually thought this was dead. I'm surprised it's back. I thought you got some pretty good feedback from council last time. So what has changed? What role does the council have? Do you have a council sponsor now? And is this supported by the Park Board? Have they voted?
Park Board has not supported this yet. They have been briefed on that it is an ongoing project. Our council liaison is Councilmember Kinnear, and this has strong community support from the Downtown Spokane Partnership and Visit Spokane, as well as supporting staff members, including myself and Kyle Tuig and the mayor's office to move forward.
But what is council's role and the Park Board's role in approval?
I'm providing information today because as we go through this process, I'm going to come back to council towards the end of the process if it's successful through our outreach initiatives and ask council to approve a contract for a private-public partnership.
So thank you for noting the safety by that report by the emergency room physicians, they liken it to this activity to the risk to whitewater rafting. And so that's what had brought up previous concerns by the council. And I understand the amalgamation of data. However, the types of injuries end up being broken bones, hospitalizations, and fatalities at a much higher rate than other kinds of family-friendly activities. So that was one of my concerns early on. I'm also concerned that some of these, where this is placed happens, unless you have a different overview, it seems to be that great vantage point of the falls would now be looking at a commercial zip line. Is there a way to show it? You know, we just spent all this money to make this great viewpoint, and now this will be right in front of it, or am I not seeing that correctly?
Well, let me go back to that slide really quick. So this is the best rendering we have at this time. We see that the platform for the zip line would take off right from the lower walkway of the CSO tank plaza. So it's already above, slightly below rather, the railing of the top deck. And from there, it follows a 8 to 9% grade decrease into Red Band Park. So there would be some wires in the way if you were on that platform, as you see there attached to the corner of the CSO tank, but you would not see those wires if you were on the top deck of the platform.
Has this come up at all about how this might interfere with people's experience?
It hasn't. We're reaching out to City Council first, so we haven't gone out further with the public at this time. We wanted to get your input, and before we start talking with other members in the community. So, like I mentioned earlier, this will be the next 4 months. We'll be at this, taking this to key stakeholders and authorities having jurisdiction over this area.
And then I'm also wondering about the safety of going underneath a highly trafficked bridge. There's debris and things that come off that bridge. I'm really surprised that we even legally could go under a bridge, but I guess we already do it with the Skyride, right?
We do the Skyride, and we do have mechanisms and procedures in place for when we see a risk coming from the bridge on how to close the Skyride, and we would work with the zipline operator to have similar practices.
And one last question. In terms of costs, have we looked into what this is going to do to increase our liability costs? If there is an accident, is the city covering this ourselves, or what does that look like? That's something I'm curious about. The revenue is interesting to me, but I also think we're going to have to invest a lot and provide space and build out to make this work, and I'm not sure how it quite pencils out. I'd like to see kind of a business plan for this.
Our expectations for this project would be that the private partner fully funds and indemnifies the city in all risks. They will carry the insurance for this project. So we don't have a business plan for it. It's going to be the one thing that we ask from the private partner to provide during the request for proposals process.
Thank you.
So why don't we do this, because we're getting short on time? Why doesn't everybody kind of start tracking their notes and their questions? And we can talk to Garrett and Jonathan to see how they want to receive those questions, if we want to do a further sit down as a study session and really kind of get those questions and concerns out there. And then that way we can devote some more time to it and really kind of get into the specifics. Will that work for everybody?
Yes, thank you, Councilmember. I appreciate that.
Okay, so we'll follow up. Brian, did you want to add something?
I was just going to tell you that we're not having the presentation from the behavioral health unit, folks. So.
Oh, okay. Okay, so anyway, if folks are okay with that, we can move on. Thank you, Jonathan. Thank you, Garrett, for the presentation. Again, write your questions down, your concerns, and let's follow up so we know going into this that we have all of our questions and concerns addressed. So we'll work on that. I'm going to call up Kyle Toohey. Sorry, Kyle, I set you back a little bit. You want to talk about engineering construction management relocation.
Thank you, Karen. Do you need me to motor mouth a little bit? Are we low on time?
You can motor mouth.
All right.
Do it.
I'm pretty comfortable talking fast, so I'll do the best I can for everybody here.
Okay, perfect.
As most of you know, we entered into an agreement with Spokane Public Schools last November to do a property exchange in order for the siting of 3 new middle schools. And as part of that exchange, part of the property was the east half of our North Foothills campus, which contains the water department, a large yard, and also the the engineering construction management office. Not sure if those of you are totally aware, I actually have split teams in my department. I have a team that typically works out of City Hall, and then we have an offsite facility where all our inspectors, surveyors, field engineers, and our construction management staff are located. It's a little over 40 staff, and we occupy about a 7,200 square foot building over there. And as part of the relocation, that's going to be right in the school's new property. So we have a lease back agreement that we can stay in that building until the spring, but we need to get out of there very, very quickly. We don't currently have, at the time of the agreement, we didn't have a destination ironed out. There was some hope that we could fit into the Nelson Service Center or another facility, and those are not adequate. We do not have the space. We didn't quite have the Public Works Capital Facilities Plan dialed in at the time. So I've spent a lot of time since last fall looking at alternative sites, all kinds of existing facilities, ideally to repurpose that and reduce costs. We've looked at Nelson, we've looked at Intermodal, we've looked at the county's 8th Avenue building, we've looked at the county's Public Works campus. All these places, there's a couple of little challenges, but I'll just cut to the chase. None of those are suitable for us, for our needs and our size and parking and staff. So we started looking at additional alternatives, one being to construct a new office for our team, either on the Foothills campus or on something like the Ranch campus or something like that. We have looked into going the old construction route and getting double wide job trailers and adjoining those to create the office space that we need. We've looked at a couple of other alternatives. The one we haven't spent money on because we didn't want to go down that road was to really get into the commercial real estate game at this point and see about getting a lease. But we were a little hesitant on, putting a bunch of money into what would be more of a short-term solution, and then also putting the money into the tenant improvements that would be required that would be a sunk cost for the city. And for those of you that have been tracking along for a long time, my team actually relocated about 4 or 5 years ago already once. We were inhabitants of the Normandy campus, there where the old street department was a while ago. So I'd love to find a solution that doesn't have me moving again 3 years later. And I think I found one. So one of the really cool opportunities just kind of popped up in conversations and working with the water department here is, back in the day, the fleet department operated on multiple sites instead of at the central center. When the fleet actually has an old shop building on the water department campus. So I'm going to throw my screen up here really quick so I can just talk visually for a second, and then and we'll keep moving here. So if everybody can see, that's the building. That's a picture of my office right there. If that's coming through okay. Sorry, I'll blow this up a little bit. That's probably small. How's that? Okay, thank you. So that's our office today. Here's that Foothills campus right there. You've got this whole couple of acres, excluding the houses in the corner here. Gonzaga Prep is above us. And then also I'll be talking a little bit about this triangle property right here, which, as you all know, is, for discussion to go to Catholic Charities. So that's kind of a part of the campus, so it's a little bit related to the conversation here. So this is the property disposition to SPS. The light blue over here is what is now school district property. The little kind of pink or purple box, whatever color is showing up for you, is our leaseback area. And then the green is what is still city's property. And then I'm not showing the triangle property up north as city property. So our team is right now located on about an acre right here down on the southeast corner of the site. It's actually kind of central south of the new school district property. And if you see this red box over here on the left of the screen, that is the old fleet warehouse, or the old fleet shop that used to be over there on the water department property. It looks like this from the outside. It's that big, long, rectangular white building if you drive in through the water department campus. Here is it from the other side. It's kind of interesting. You got those big bay doors that pass through on the two drive aisles in there. And then inside the shop, it's very underutilized. And working with the water department, they'd have no issue giving up what little storage that they have in there right now. Here's a shot from the other side. It's very lightly used. It actually has about a 6,000 square foot footprint. So what I'm proposing to do actually was an idea that came out of something I'd done in a past life, but it's a building in a building concept. So we utilize the existing shell of this building. It's got a great structure to it. We've got 21 feet height to that old crane that's up there. So we can actually build a 2-story wood frame building inside this building envelope, which gives us some really cool advantages when it comes to cost, because we're not building new siding. We have the structural components. We don't have to rehab the roof and heat the whole space. We can do all that within our new shell, but we don't have to have a 30-year roof over it because we have a roof over our head. So it's kind of interesting. You separate that whole waterproofing and exterior side, but you do all your insulation and all of your, all your electrical and plumbing and all the other components inside. This also has the advantage that we have water and sewer and fiber optic and communication to the site. So we have a lot that's already right there to that building. Oh, and gas is the other one we have at that building. So what we're proposing to do is to actually just get a design team on board. Here, I'll stop sharing for a second so that it's not distracting. Get a design team on board, frame up that office, either put it out to bid or consider partnering with Spokane Public Schools and utilizing the contractor that they have already on site for the construction of the Northeast Middle School. It's also one of the other things this gives us the opportunity to do there, because as you know, when the Triangle property to the north gets disposed of, we have some staff that's on that site as well, some from code enforcement and some from the water department. And I would propose building the square footage for the water department included in this build. We have a couple of water inspectors that work for my staff, and this would keep them contiguous with that. Also, I didn't even mention, I have a materials lab, and it's not the kind of lab with beakers and test tubes. We literally burn and shake rock and asphalt, and that's how we do all our materials testing for our roads and road beds. And so that's actually adjacent in that building. It would be right there, which is great because my inspectors are in there a few times a week, dropping off samples and picking up testing materials and our gauges and things like that. So we would be able to take care of that. It gives us the opportunity to, having that shell, we can build over the winter months, which will save us a lot of time for getting out of there, and keeps us in a great location. And we would be part of the parking solution that is already kind of a joint campus issue with the water department. We would partner on that solution in order to make sure that we can accommodate both our parking needs as well as the water department parking needs. And so think this is definitely our least cost long-term solution that'll work for our staff. We're looking at some kind of cool options for bringing natural light into that building, converting 2 of the big garage bay doors into storefronts, which will bring in a ton of natural light pass through, some clear story kind of office space layouts. And if we need to, there's a way to bring in even additional natural light into the building between the roof course and where the structural CMU stops. There's about a 4-foot gap in there that we know we can very cheaply retrofit to add in even more natural light if need be. So we're trying to move real quick on this. I wanted to make sure council understood what the plan was and what we were moving forward to. I don't know exactly yet how we're going to deliver it, so I don't have a contract in front of you yet. It could be an interlocal agreement with Spokane Public Schools, or it could be a construction contract, depending on where that plays out right now. And we're having discussions with SPS as we speak, as we continue to work together on this. So can I answer any questions? You guys want me to put the map back up? How can I be of help?
I just want to make sure that the parking problem is going to help the water department as far as parking, that you're going to partner together with both divisions to have parking.
Indeed, we'll have a joint plan. I've been working with Laura Searle already, pretty detailed on that, because we got to relocate that. We have to protect the wellhead, and then we have to add some additional capacity for my team as well. So that parking solution is like a phase 2 of this project. They need to be done together, but they don't have to be done in exactly the same time frame.
Anybody else have questions, concerns, information? Kyle, you did good. Thank you.
Thanks, Karen.
Well, for anybody that there's no contract yet in place, you're kind of moving this forward, you're not sure where you're going, but if anybody has questions or concerns, Kyle, and he can get back and answer questions.
Absolutely.
Thank you. So we are not going to have the behavioral health unit contract. I'll be really quick with Betsy, and we can send everybody out an email update on Fort George Wright Drive. There's a meeting tomorrow with the Community College's Board of Trustees. Is that correct, Betsy? To talk about the plan. We have made contact with the tribe, who is going to be putting together a group to talk names and to kind of get those suggestions out there. We're staying in touch with them. Betsy, is there anything you want to add?
No, that we just have one apartment complex that we have to engage, but SNAP is, all the other players around that area are very supportive of the name change, along with the neighborhood council. So I feel that this is our time to go forward. So I'm excited.
We're going to move it forward. Candace, did you have a question? No?
No, we did have the outline that was provided from the planning group, so we're on process.
Perfect. Michael?
Just process-wise, does this go to Planning Commission for them to make a determination on name? Is that correct?
Yeah, the Planning Commission, yes, they kind of head all of that up. But we can send, if I understand this correctly, Candace can help me, we can send them our suggestion or recommendation for a name, correct, Candace?
Oh, anyone in the public can send their ideas. And in fact, the last time we did this, the administration did a great job of outreach to the public. They had over 100 different name ideas that came in, and it was really a great public process. They did it on social media, and all the news stations got it out. And so it's a real public process. There'll be public hearings at the Plan Commission level and at the City Council level as well. So they have a good process in place.
And we have a group that's working with the tribes that we've talked to about sitting down and putting together what they think, even if it's a couple names, what they would highly recommend that name be. So that'll be in the mix as well.
And if there's a form or a survey that's put together, I'm happy to push that out to try and get more feedback. What do you think is the overall timeline for when this would come back to council for a final decision?
They're working on it this fall. I apologize. I just got my phone here to open Tammy Palmquist sent it to us, and I'll try to find it for you, okay?
Great. We can get that sent out to folks. Okay. And Tim, before I end this, did you want to talk, all I had was a note, 2021 budget as far as relating to urban experience?
Thanks, Councilmember Stratton, and this comes from, Council President Beggs can jump in too if he wants. A while back, I sent a request to all the council members for thoughts and suggestions that you had for the 2021 budget. And I think we've gotten about 30 to 35 different suggestions. Some of them are similar. Some of them are competing. But in conversation with Council President and a couple other council members, we thought we would bring them forward to at least let the full council see these broken down by committee. And of the 35, as you can imagine, I think probably close to half of them, if not quite half, are related to public safety, community health, but there were about a half a dozen related to urban experience. 3 of them are fairly similar, and I'll have to admit my technology skills aren't that great, so I don't want to try and pop them up there, but I'll make sure you all get them. But what I can do is just kind of go through them real quick and then be done, because I know you're running short on time. But the biggest, the thing that got the most hits was planning. There was one basically saying, oh, thank you, whoever put that up, fully staffing of the planning department. And then I put in the last caveat that for most of 2020, there have been 3 vacant positions in planning. One being the director. While I know that they are, I think Lewis has been in an acting capacity, so that means his base position is technically vacant. And then there's also been an entry-level planner and an entry-level, I think, urban designer that have been vacant. And then the bottom 2 kind of go along with this. One was providing adequate staffing to make permitting processes more expeditious, and then also one to maybe look into potential monetary incentives such as fee waivers. So those are 3 of the 6 related to planning. Then there was one talking about using BDS and economic development, if we need to make reductions in those departments to offset other increases or general fund costs. One was related to elimination of the multifamily tax exempt program. And then the last one was changing the project employee in historic preservation from part-time to a permanent full-time. I think we've had a part-time position there several years, 4 or 5 years at least. So those were the ones I could identify for urban experience. And we want to just, like I said, just at each of the next 4 committee meetings, get these out to all the council so that you guys can start having discussions about them. I know that starting in, I believe, October, the finance department, Tanya, is going to be doing the same thing with various changes that they're looking at for the budget on the administration side. So we want so that we're not doing competing times. We want to get these to you this month, and then the first part of October we'll finish up.
I was just going to add to everyone, we're trying to do this by lines of business by committee, and that's what the administration is going to do. If we had more time today, we would have a little more of a discussion about people's thoughts, because as you can see, some of these are contradict each other, but we don't have time today. Hopefully next week at finance, we'll have more time and for the finance ones, which there's only a few of them, and maybe we'll pick up these ones, so we'll catch up.
That makes good sense. I would recommend that we do that because I think some of these are worth talking about. Okay, anybody have, Tim, thank you for those. Anybody have questions? All right, I'm going to go ahead. Meeting is over, and I'll see everybody in about 20 minutes. Thanks. Sorry we went late.